Good morning, welcome back. About 11 minutes before 7 o'clock. Well, it's something that can happen somewhat unexpectedly and be detrimental to families who are facing it. We're talking about childhood cancer, and here to talk about this issue from Gunderson Health System this morning is Toni Peters. Toni, thanks for joining us this morning.
Good morning. Thank you for having me.
So,
Obviously it's...
Yes, go ahead. No, go ahead. Just lead us in.
Well, obviously it's always a shock when children are diagnosed with cancer, and one of the things that we worry about after a child has been treated for cancer is then the late effects of that treatment. So one of the things that we've long known about for the treatment, after the treatment of that cancer, is the late effects of that treatment. So starting a long time ago, about 20 years ago, a study was started called the Childhood Cancer Survivor Study, where they took a cohort, it's called, of over 14,000 survivors of childhood cancer, and started looking at the late effects that these then young adults had from the effects of their treatment. These survivors are now entering their 40s and 50s. Oh, wow. And so we've seen what effects they had from their treatment. And it turns out the vast majority of their survivors are actually doing quite well, but unfortunately they do have 3 times the risk of major effects from their treatment. But unfortunately it's not... sorry, go ahead.
Just wondering, what sort of effects might those be?
Well, it's not quite so simple to be able to say what exactly those will be. It very much is dependent on what their treatment was. What type of cancer did they have, and exactly what chemotherapy did they have. Some chemotherapy medicines can cause effect on the heart, some can cause effect on the lungs, and if patients got radiation, the effect can be very specific to where they received radiation.
Sure. We are up against time a little bit here, so just tell me really quick, if you can, is this, do you think, going to spur research to maybe change the way we treat childhood cancer?
Absolutely, and it already has. We frequently, if possible, research has been done for the types of cancer that we do really well treating. We do clinical trials to see if we can actually reduce the intensity of therapy for those types of cancers.
Okay, Toni, so thank you so much. So much good information this morning on what could be, a devastating time for families. So we appreciate you being here with us this morning.
Thank you.